Most people accept cold feet as just a normal, inevitable part of getting older. They put on thicker wool socks, they complain about the drafty floorboards in the hallway, and they simply move on with their day. That is a dangerous, potentially life-altering lie. If both your feet are cold, sure, go ahead and turn up the thermostat or put on some slippers. But if one foot is colder than the other, that is not aging. That is not a draft. That is your body screaming at you. It is a specific, urgent, biological warning sign that something in your internal plumbing has stopped working. You might not feel any sharp pain yet. You might just feel a nagging chill that you can't seem to shake, no matter how many blankets you pile on. But this asymmetry, one warm, one cold, is often the single number one predictor of future tissue damage and mobility loss. It means blood is struggling to fight its way to where it needs to go, or the electrical signals telling it to go there have been severed. If you ignore this today, thinking it's just winter weather, you risk missing the incredibly narrow window where simple, non-invasive changes can fix the problem. You do not want to wait until the skin changes color to a pale wax or a dark purple. You do not want to wait until the pain becomes unbearable at night. By then, the options are aggressive, scary, and surgical. We are going to do a comprehensive, deep dive 5-minute circulation check right now. You do not need a medical degree, and you don't need expensive equipment. You just need your hands, a chair, and a few minutes of focused attention. We are going to find out exactly what is happening inside that cold foot before a doctor has to intervene with a scalpel. Do not click away, because what you learn in the next few minutes could quite literally save your ability to walk to the mailbox next year. To fix this, you have to understand the machine you are operating. Think of your leg like a house. Inside the walls of your home, you have copper pipes carrying water, and you have electrical wires carrying power. Your leg is no different. The pipes are your arteries, the highways carrying fresh, oxygen-rich blood down from your heart to your toes. The wires are your nerves, sending sensory signals back up to your brain. When a foot goes cold, it is almost always a failure of one of these two systems. Either the pipes are clogged with plaque and rust, which doctors call peripheral artery disease, or the wires are cut, frayed, or damaged, which is neuropathy. We need to figure out which one it is right now. This isn't just medical trivia for a quiz. The difference matters critically because the treatment for one is often poison for the other. A groundbreaking 2024 study involving thousands of adults over 50 confirmed that early detection of this temperature difference can reduce the risk of severe mobility issues by over 60%. That is a staggering number. It means the power is in your hands, literally. Try this simple check before we even get to the main tests. Wiggle your toes right now inside your shoes or socks. If they move, if you can see them wiggling, but you can't feel the fabric of your sock rubbing against your skin, keep listening closely. That is the number one sign of the wiring problem. If your pipes are clogged, your foot is starving for fuel. It's like a car running on fumes. If your wires are bad, your foot is physically there, but your brain can't see it properly. The check we are about to do separates the plumbing problem from the wiring problem. It simplifies a complex medical diagnosis into a yes or no question you can answer in the privacy of your living room. Before we start pressing on toes and hunting for pulses, I have to warn you about a habit you probably have. This is critical. When a foot gets cold, your instinct, your gut reaction, is to do one specific thing to get relief. Almost everyone does it. It feels logical, it feels comforting in the moment. You might even be doing it right now while you watch this video. Here is the scary part. If your cold foot is caused by a plumbing issue, blocked arteries, this specific comfort habit is dangerous. It actually forces blood away from your toes. It fights against the little flow you have left. It accelerates tissue death because you are inadvertently starving the foot even more. I am going to tell you exactly what this dangerous habit is, and the counterintuitive move you must do instead to save your foot. It goes against everything you have been told about swelling and injuries. But I want you to understand the why first. If I just tell you now, you might not believe me. We need to run 3 quick tests on your foot first. Once you see the results of these tests, the solution will make perfect sense. So keep that in the back of your mind. Your natural instinct might be wrong. Let's find out why. Let's jump into the first test. This is called the capillary flash. We are testing the microcirculation, the tiny microscopic roadways that deliver blood to the skin surface. These are not the highways. These are the driveways that feed the cells directly. Sit in a comfortable chair where you have good light. You need to see your toes clearly. Take off your socks. I know, the floor might be cold, but we need bare skin for this. Now, look at the cold foot. I want you to reach down and grab your big toe. Squeeze the very tip of it, right on the fleshy pad, firmly between your thumb and index finger. Squeeze it hard enough that the skin under your thumb turns white. You are physically pushing the blood out of the tissue, wringing it out like a wet sponge. Hold that squeeze for 3 seconds. 1, 2, 3. Now let go immediately and watch the skin closely. You are looking for the flash of pink color returning. In a healthy foot with good plumbing, that white spot should turn pink again almost instantly. It should be a flash. If you let go and the toe stays white or pale for longer than 2 seconds, your microcirculation is sluggish. The blood is struggling to get back in to fill the void. It's like turning on a faucet and waiting for the water to sputter out. Try this now. Press the toe firmly. Count 1 Mississippi, 2 Mississippi. If it's still pale after you finish counting, take a mental note. That is a sign that the pressure in your pipes is low. It means the blood is arriving at the destination with no force behind it. In fact, research from the Mayo Clinic confirms that a delayed capillary refill time is one of the earliest, most reliable indicators of peripheral vascular issues, often appearing years before major pain sets in. This little squeeze gives you a window into the future of your foot's health. Now for the second test. This one is the pulse hunt. This is a bit harder to master than the toe squeeze, but it is the gold standard for checking your main pipes. You are looking for the dorsalis pedis artery.
It runs right over the top of your foot. Take 2 fingers, your index and middle finger. Do not use your thumb. This is a common mistake. Your thumb has its own strong pulse, and if you use it, you might feel your own heartbeat in your thumb and think it's your foot. That will give you a false positive. Slide those 2 fingers down the top of your foot. You want to aim for the space right between the big toe and the second toe, but higher up on the arch, closer to the ankle. You are looking for a valley between the tendons. Don't just press down hard. Explore the landscape of your foot. If you don't feel it instantly, don't panic. It often hides. Try shifting your fingers just a millimeter toward the outside of the foot. Silence here is a finding, but so is a weak flutter. It shouldn't feel like a drum. It might feel like a butterfly trapped under the skin. Now here is the key. Compare it to the warm foot. Find the pulse on your good foot first, so you know what you are looking for. Get a baseline. Now switch to the cold foot. Is the pulse harder to find? Is it much fainter? Or is it completely missing? If you can find a strong beat on the warm foot, but nothing on the cold foot, your main pipe has a kink. The blood is hitting a roadblock somewhere in your leg before it reaches your ankle. This is a classic textbook sign of arterial blockage. It means the highway is closed and traffic is backed up. Comment pulse found below if you manage to locate that beat, or no pulse if it's hiding from you. It takes practice, so don't panic if you miss it the first time. Sometimes swelling can hide it. Sometimes it's just anatomy. But if it's missing on one side and strong on the other, that is the red flag we are looking for. Test number 3 is the sensation map. This helps us decide if the problem is the wiring. For this, you need a simple household item. Grab a piece of tissue, a Kleenex, or a cotton ball, something very soft, very light, and wispy. Sit back and close your eyes. This works best if you can have a friend or partner do it for you, so you can't anticipate the touch, but you can do it yourself if you can reach without straining. Take that soft tissue and brush it lightly over the skin of your cold toes. Don't rub, just a whisper of a touch, like a feather landing on your skin. Can you feel it? Does it feel sharp and clear like it does on your hand? Or does it feel distant? Does it feel like you are touching the foot through a thick wool sock, even though you are touching bare skin? Does it feel like cotton wool or static? If your foot is cold, but you also have this numbness or cotton wool feeling, that points to the wiring. If you have a strong pulse from the last test, but you fail this sensation test, the problem is likely neuropathy, nerve damage, rather than a blood clot. The pipes are fine, but the wires are cut. However, if you have no pulse and no feeling, that is a double warning. That means the tissue is starving and the nerves are dying because of it. This triggers a process called autophagy. Think of it as your body's internal recycling crew starting to break down cells because they aren't getting resources. You want to stop that process before it takes healthy tissue. Safety note here, if you have balance issues or get dizzy easily, please do this while seated firmly. Do not try to bend over and test your feet while standing up. We want to fix your foot, not cause a fall.
Okay, remember that dangerous habit I warned you about in the beginning? The comfort mistake? Let's resolve that now. The dangerous habit is elevation.
When we have a sprained ankle, a bruise, or a swollen knee, doctors always say RICE: rest, ice, compression, elevation. We have been trained for decades to prop our feet up on pillows. It feels like the healthy thing to do. So when your foot feels cold or aches, you probably put it up on the recliner or stack it high on pillows in bed. If your cold foot is caused by a plumbing issue, blocked arteries, elevation is the absolute worst thing you can do. Think about the physics. Your heart is in your chest. Your feet are far away. If the pipes are clogged, your heart is already struggling to push blood all the way down there. It's fighting resistance. When you elevate your legs, you are asking your heart to push blood uphill against gravity. It can't do it. The pressure isn't high enough to overcome the blockage and the hill. The blood drains out of your feet, leaving them pale, starving, and even colder. You are literally cutting off the supply. You are suffocating the foot. If you have cold feet due to arterial flow, you must let the leg hang down. You need gravity to be your ally, not your enemy. Gravity helps pull the blood down into the toes where it is needed. If you sit in a recliner, keep your feet on the floor. If you are in bed and the pain starts, you might even need to dangle the cold leg off the side for a few minutes to get the color back. Never prop a cold, pale foot high up on a stack of pillows. You are fighting a battle your heart cannot win. This simple shift, keeping the foot low, can be the difference between a night of agony and a night of sleep. It gives you the stability to carry groceries up the stairs without a second thought because your muscles are actually getting fuel. Now, you might stop here and think, okay, I won't elevate my leg. I'm good. But what if you passed the pulse test, passed the sensation test, and your foot is still freezing? Do not scroll away, because there is a silent imposter that mimics a clogged artery, but has nothing to do with your leg. The criminal isn't in your shoe, it is hiding in your lower back. Your spine houses the master cables that run down to your legs, specifically the L5 and S1 vertebrae in your lower back. These are the roots of the sciatic nerve. If you have inflammation, arthritis, or a bulging disc there, it can compress the nerves that control the width of your blood vessels. This is part of the autonomic nervous system. When that nerve is pinched in your back, it can send a false signal to the blood vessels in your foot to constrict or tighten up. This shuts down the blood flow, making the foot feel ice cold, even if the main arteries in the leg are technically clear. It's a false alarm that has real consequences. If you have a history of sciatica, lower back pain, or stiffness in the mornings, and you also have one cold foot, the fix is likely in your spine, not your shoe. You need to treat the back to warm the foot. Stretching the hamstrings, doing gentle lumbar decompression, or seeing a chiropractor might be the key to warming up your toes. It is a connection most people miss entirely. They treat the foot for years with creams and socks, never realizing the switch is flipped off in the basement, not the living room.
Hit that subscribe button if you want more tips on connecting these hidden body dots. We talk about these weird connections all the time, helping you decode your body's signals before they become emergencies. Now that we know what to look for, let's talk about a way to help. We need to manually force blood into that lower limb. We're going to use your calf muscle as a second heart. Did you know your calf muscle is often called the peripheral heart? When it contracts, it pumps blood. When it relaxes, it draws blood in. We can use this mechanism to override a sluggish system. The gas pedal pump is a simple movement you can do while watching TV. It is safe and low impact. Sit on the edge of a sturdy chair with your feet flat on the floor. Lift your heels as high as they can go, pressing your toes into the carpet. You should feel your calf muscle tighten up into a hard ball. Hold it for a second. Squeeze it. Then drop your heels and lift your toes as high as they can go toward your shins. You should feel a stretch in the back of the ankle. Rock back and forth like this. Heel up, toe up. Heel up, toe up. This rocking motion mechanically pumps venous blood out of the leg and crucially encourages arterial blood to flow back in when the muscle relaxes. It primes the pump. It creates a vacuum effect. Try doing 20 reps of this rocking motion right now. You might feel a little warmth starting to generate in the lower leg. That is the goal. You are manually driving the circulation. Safety warning, stop immediately if you feel sharp cramping or pain in the calf. That could be a sign of something else, like a deep vein issue, and you should rest. But for most, this is a safe, effective way to wake up the pipes. I need to give you a serious warning about warming up that foot. When your foot is cold, your instinct is to blast it with heat. You reach for the hot water bottle, the electric heating pad, or you stick it in a scalding hot bath. Do not put a heating pad directly on a cold foot. Here's why.
If you have the wiring problem we talked about, neuropathy, your ability to feel heat is damaged. Your thermostat is broken. You might not feel that the water is boiling or the pad is set to high. You won't feel the skin burning until it is too late. Hospitals see this constantly. It is a silent epidemic. Diabetics with cold feet come in with third-degree burns because they fell asleep with a heating pad on a numb foot. It is tragic and completely preventable. They wanted comfort, and they got a catastrophe. Instead of heating the foot directly, warm the core of your body. Put on a sweater, drink hot tea, wear wool socks to trap your own body heat. But never apply direct high heat to a numb limb. It is a thermal shock that your skin cannot handle. Furthermore, if your arteries are clogged, applying heat increases the metabolic demand of the cells. The cells get hot, they try to work harder, they need more oxygen. But the arteries can't deliver it. So you are increasing the demand without increasing the supply. This can actually cause tissue damage faster. Keep the foot warm with socks, yes, but do not cook it with external heat sources. Let's talk about one more factor that people ignore: hydration. Your blood is a fluid. Think about the difference between water and maple syrup. If you are dehydrated, your blood becomes thicker. It becomes more viscous. If you have narrow arteries, pushing thick, syrupy blood through them is incredibly difficult for your heart. By simply drinking a large glass of water, you thin the blood slightly, making it easier to push through those narrow capillaries we tested earlier. It is the cheapest medicine in the world. If your feet are cold, drink a glass of water before you do anything else. You might be surprised at how much it helps the flow. When does this stop being a home check and start being an emergency? You need to know the red flags. You need to know when to call 911. If your cold foot suddenly turns pale, white, or blue, that is an emergency. If you feel sudden, intense pain in the leg or foot that does not go away when you rest, that is an emergency. If the foot feels paralyzed or heavy, like dead weight, or if you suddenly lose the ability to move your toes, these are signs of an acute blockage, a clot that has completely shut off the pipe. This is not a wait-and-see situation. This is not a wait for the doctor's appointment next week situation. This is a go to the hospital now situation. Time is tissue. The faster you get help, the more likely you are to save the leg. Doctors have a saying: time lost is leg lost. Talk to a clinician immediately if you see sudden color changes combined with pain. Don't be polite. Be loud about it. Advocate for your legs. One cold foot is a message. It is your body trying to tell you something about your plumbing or your wiring. Listen to it. Don't silence the messenger with just a thicker sock. Check the pulse. Check the color. Remember the elevation rule. If it's arterial, keep it low. Keep moving those ankles with the gas pedal pump to keep the system flowing. Your mobility is your independence. You have to protect it proactively. Don't wait for the pain to force you into action. Let's review the why this matters to you one last time. Imagine wanting to go to your grandchild's graduation, or a wedding, or just the grocery store, but being unable to walk more than 50 feet without stopping. That is the reality of untreated vascular disease. But by doing these checks, by keeping the blood flowing, by respecting the gravity rule, you are buying yourself years of freedom. You are ensuring that you are the one deciding where you go, not your legs. We have covered a lot today. We talked about the capillary flash, the pulse hunt, the sensation map. We busted the myth of elevation. We exposed the silent imposter in your spine. And we learned the gas pedal pump. This is a lot of information, but it is actionable. Start with the toe squeeze. Do it today. Do it right now. Check out our other great video about one foot colder than the other, the 5-minute circulation check. It goes deeper into the diet side of things, discussing foods that boost nitric oxide, the molecule that relaxes your blood vessels. Tap the card on the screen right now to keep learning. Your feet will thank you. Remember, your body is a brilliant machine, but it needs a good operator. Be that operator. Stay warm, stay safe, and keep moving. There is one final secret regarding the pulse hunt that I didn't mention earlier, and it is crucial for those of you who struggle to find that beat on the top of the foot. If you couldn't find the dorsalis pedis, there is a backup pipe. It is called the posterior tibial artery. It is located on the inside of your ankle, just behind that big bony bump, the malleolus.
Take your same 2 fingers and curl them around the inside of your ankle bone. Press gently into the soft spot between the bone and the Achilles tendon. Sometimes the top pipe is blocked or naturally small, but this inside pipe is booming. If you find a strong pulse here, your foot is still getting good flow. Checking both gives you a complete picture. So if you panicked earlier, try this spot. It might be the reassurance you need. Let's talk about the texture of the skin for a moment. This is a subtle sign that many people miss. In a healthy foot, the skin should be supple and perhaps have a few hairs on the toes. Yes, hairy toes are a good sign. It means there is enough blood flow to support hair follicles. If your cold foot is perfectly smooth, shiny, and hairless, while your other foot has hair, that is a sign of long-term starvation. The body stops wasting energy on growing hair when it is struggling to keep the skin alive. Shiny, tight skin is a warning. It looks polished, but it is actually atrophying. If you see this shiny skin, you need to be extra diligent with the gas pedal exercises. You need to double down on your hydration. You need to make sure you are not smoking, as nicotine constricts these vessels violently. Let's go deeper into the gas pedal exercise. I want to give you a variation for those of you who might have limited ankle mobility. If you can't do the full rock, try the alphabet. Lift your cold foot slightly off the floor. Pretend your big toe is a pen. I want you to write the entire alphabet A through Z in the air with your big toe. A, B, C. This forces the ankle to move in every possible range of motion. It engages the calf, the shin, and the deep stabilizers. It wrings out the fluids from every corner of the joint. By the time you get to Z, your foot should feel warmer. It is a fantastic way to wake up a numb foot while sitting at the dinner table or watching the news. And speaking of sitting, let's address the cross. Many of us sit with our legs crossed. We throw one knee over the other. If you have one cold foot, you must stop crossing your legs. When you cross your legs, you are putting direct pressure on the popliteal artery behind the knee. You are kinking the hose right at the source. If your flow is already compromised, crossing your legs is like stepping on the garden hose. Uncross them. Keep feet flat. Keep the channels open. It's these tiny micro habits that add up. The elevation, the leg crossing, the dehydration. Individually, they are minor. Together, they are a disaster for a compromised leg. Fixing them costs nothing, but the payoff is massive. I want to revisit the sensation map test with the tissue. If you found that you had numbness, you need to be incredibly careful with your footwear. You cannot rely on your foot to tell you if a shoe is too tight. You cannot rely on your foot to tell you if there is a pebble in your shoe. I have seen patients walk around for days with a tack stuck in their shoe, puncturing their foot, and they had no idea because the wires were cut. They only noticed when they saw blood on their sock. If you have that cotton wool feeling, you must visually inspect the inside of your shoes every single time you put them on. Shake them out, run your hand inside. Be your foot's eyes, because its feeling is gone. This simple 5-second habit, shaking out the shoe, prevents ulcers that can lead to amputation. It is that serious. Let's connect this back to your heart. Peripheral artery disease, the clogged pipes in the legs, is rarely just in the legs. If the pipes in your basement are rusty, the pipes in the attic are probably rusty too. If you have a cold foot due to blockage, it is a strong indicator that you might have plaque in the arteries of your heart or your brain. Your legs are the early warning system. They are the canary in the coal mine. By taking this cold foot seriously, you are not just saving your leg, you are getting a heads up about your cardiovascular health. It is a prompt to get your cholesterol checked, to look at your blood pressure, to clean up your diet. The foot is doing you a favor by complaining. Thank it, and then take action. So, let's summarize the 10-10 action plan for today. 1. Check. Do the capillary flash, the pulse hunt, top and side, and the sensation map. Know your status. 2. Correct. Stop elevating the leg if it's arterial. Stop crossing your legs. Start drinking water. 3. Activate. Do the gas pedal pump or the alphabet whenever you are sitting. 4. Protect. Inspect your shoes. Keep the foot warm with wool, not electric heat. 5. Consult. If you find a deficit, no pulse, no feeling, make that appointment. Tell the doctor, I have an asymmetry in my lower limb circulation. They will listen. You are now armed with more knowledge than 90% of the population. Most people just put on the extra sock and ignore it. You are not most people. You are taking charge. The journey to better health isn't about one giant leap. It's about these small, consistent steps. It's about understanding the machine. It's about listening to the whisper before it becomes a scream.
One final thought on the sensation map. If you are unsure about the result, try the temperature test. Take 2 spoons, put one in warm water, not hot, and one in cold water. Touch them to your foot. Can you tell the difference instantly? If you can't distinguish warm from cold, that is a profound loss of small fiber nerve function. That is your cue to be hypervigilant about burns and frostbite. Your body is resilient. It wants to heal. It wants to flow. But it faces obstacles: gravity, plaque, pressure. Your job is to remove those obstacles. Uncross the legs, lower the foot, pump the calf, drink the water. Simple, powerful, effective. Don't let the fear of what you might find stop you from checking. The fear is useful if it drives action. It is dangerous if it drives paralysis. Look at your feet right now. They have carried you thousands of miles. They have supported you through decades of work and play. They deserve 5 minutes of your attention. Give them that attention. And remember the silent imposter in the back. If the foot tests are clear, look to the spine. Stretch the hips. Decompress the back. The relief might flow down from above. We are building a community of people who are proactive about their aging. We don't accept "it's just old age" as an answer. We ask why, and then we fix it. Thank you for investing this time in yourself. It is the best investment you can make. Keep those pipes clear, keep those wires firing, and walk confidently into your future. If you found the pulse, if you felt the tissue, if you learned something about elevation, you are already winning. Keep going. There is a concept in medicine called collateral circulation. This is the body's amazing ability to grow new blood vessels around a blockage.
It's like building a bypass road around a traffic jam. But here's the catch. Your body only builds these new roads if it senses a demand. The gas pedal exercise creates that demand. Walking creates that demand. By moving the muscle even when it hurts a little, within reason, you are signaling to your body, "We need more roads here," and the body responds. It releases growth factors. It builds new capillaries. So when you do those ankle pumps, you aren't just moving blood today. You are instructing your body to build the infrastructure for tomorrow. You are the architect of your own circulation. That is a powerful thought to hold on to. You are not a passive victim of your anatomy. You are an active participant in its remodeling. So, construct those roads, pump those calves, and never, ever ignore a cold foot. One last tip regarding socks. Since we talked about not using heating pads, the type of sock you wear matters immensely. Avoid cotton. Cotton absorbs moisture and holds it against the skin. If your foot sweats, the cotton gets wet and then gets cold. It acts like a refrigerator coil against your skin. Switch to merino wool or synthetic blends that wick moisture away. A dry foot is a warm foot. A wet cotton sock on a foot with poor circulation is a recipe for chilblains and further cooling. It's a small change, buying different socks, but it changes the microclimate of your foot completely. Look at the elastic band at the top of your sock. Is it leaving a deep red indentation in your calf? If so, it is too tight. It is acting like a tourniquet, slowing down the venous blood trying to leave your leg. Switch to diabetic socks or loose top socks. You want warmth, not compression, unless prescribed by a doctor. Every detail matters. The sock material, the sock tightness, the shoe fit, the leg position, the hydration. It is a system. Optimize the system and you optimize your health. You have the tools, you have the knowledge. Now you just need the consistency. Make the circulation check a weekly habit. Make the gas pedal a daily habit. Your future self, the one who is still walking, still traveling, still active, is thanking you for watching this today. Be proud of taking the step. Now, go wiggle those toes and keep them warm the right way. End of the line. The check is complete. You are ready.